Welcome to Chapter 4, Documentation for Statistical Reporting and Public Health. In today's learning objective, we will study how statistics are used in healthcare, distinguish between primary and secondary data, compare and contrast patient-identified data with aggregate data, relate how health record data are used for research and statistics, define healthcare databases in terms of purpose and content, explain the use of health record data in clinical trials, identify the role of health record documentation in public health reporting, define vital statistics, trace the flow of information and reporting vital statistics, identify data quality issues to yield statistical information for administrative and clinical decisions. We will describe the roles and content of a master patient index, recognize secondary data sources, identify facility-specific indexes, list routine healthcare databases, and identify data elements in standardized clinical data sets. So let's get started. Data contained in the health record are required for research, statistical reporting, and a variety of registries such as the Cancer Registry, Tumor Registry, Burn Disease, Immunization, and then there's a Birth Certificate Registry. Documentation from disease-specific registries may be utilized with incentive payment systems that are based on the quality of care provided to the patient. Documentation needed for research ranges from identification of candidate health records for projects to actual review of selected records and abstract preparation or collection of data from them for physicians or clinical researchers. Now, research is defined as the investigation or experimentation aimed at the discovery and interpretation of facts, revision of accepted theories or law in the light of new facts, or practical application of such new or revised theories or laws. An HIM professional may be called upon to provide information for a clinical trial. A clinical trial is an investigation of the safety and effectiveness of a new treatment or test. The trial proceeds according to a protocol, and a protocol is a list of rules and procedures to be followed. Clinical trial database allow physicians and patients to locate a clinical trial. For example, if a patient would like to participate in a clinical trial but does not know how to find the right one, then the clinical trial database may assist the patient in identifying the best clinical trial for the patient's disease. The National Library of Medicine has developed a database called clinicaltrial.gov. And this is used by both consumers and practitioners. So information in the database includes the following: abstract of clinical protocol studies, summary of the purpose of the study, recruiting status, criteria for patient participation, the location of the trial, and specific contact information. Additional information may help a patient decide whether or not to consider a particular trial. Research study design, phase of the trial, disease or condition, and drug or therapy under study. The health of population in geopolitical locations is in the domain of public health. One of the duties of public health agency is surveillance of the health status of the population within their jurisdiction. The Centers of Disease Control and Prevention WONDER database is an integrated information and communication system for public health. Its purpose are twofold: to promote information-driven decision making by placing timely, useful facts in the hand of the public health practitioners and researchers, and to provide the general public with access to specific detailed information from the CDC. The CDC WONDER's mission are used to promote health and prevention disease by expediting access to public health information for government and community organizations such as the U.S. Public Health Services, state and local health department, and the academic public health community. The WONDER system covers topics of chronic conditions, communicable disease, environmental health, health practice and prevention, injury prevention, nationally notified conditions, occupational health, reference data, and tools from the CDC. So take a look at Figure 4.1 and 4.2, which displays a sample of the public data available in the WONDER database. Review the charts and the type of data that's displayed within them. Okay. The National Center for Health Statistics compels the nation's statistical information to guide action and policies to improve health. It uses health statistics to document the health status of the U.S. population and selected subgroups, tracks the impact of major policy initiatives, including the Affordable Care Act, documents access to and use of the health systems, identifies disparities in health status and use of health care by race and ethnicity, socioeconomic status, other population characteristics, and geographic region. It also monitors trends and health indicators, support biomedical and health services research, provide data to support public policies and programs, including recent data on opioid overdose death. The NCHS collaborates with the health community and uses a variety of approaches to obtain information.